Hi, everyone. This is Dr. Christina Rahm. I'm going to read the medical disclaimer real quick, and then I'm going to jump into Root U. This is information that's only for educational purposes. It's not medical advice or substitute for medical advice of physicians or other qualified healthcare providers. You should not use this information for diagnosis of health, fitness problem, or disease. You should always consult with a doctor or other healthcare professional for medical advice or information about diagnosis and treatment. We do not claim to treat, diagnose, mitigate, prevent, or cure the disease. I wrote the book, I'm the author for Cure the Causes. And what I mean by that is get to the root of the cause and try to make your body as beautiful and amazing as it can be. We're going to talk about cervical health today. Cervical health, and I always do like the heart to show people about cervical health, plays a vital role in your overall well-being as an individual, particularly, of course, for women. The cervix is a critical part of the reproduction system, not only supports reproductive health, but also serves as a key indicator for a broader health concern and broader health concerns. Ensuring its health is essential for maintaining a high quality of life. And I say this all the time, it's not just the quantity of your life, it's the quality of your life. It's really, really important. And cervical health is important for overall well-being. Conditions affecting the cervix can actually cause cervical dysplasia or cervical cancer and can be a precedent to it. So you have to be very careful about that, and you have to constantly monitor that and make sure. But the problem is it's hard sometimes to catch it. So early intervention is so important. That's why you should always have checkups from your doctor. Significance of Cervical Health Awareness Month is that you really focus on the cervix and the importance of diagnosis and the importance of the health of the cervix. The anatomy of the cervix has to do with the endocervix and the endocervix. So that is the external portion and the internal portion. A lot of times people say February is Cervical Health Month, but I always say every month is Cervical Health Month because it's something that so many times we don't talk about and we don't understand, and we have to. The cervix is the lower narrow portion of the uterus, so it's connected to the vagina. And we're coming out with a sex book that I wrote. I talk about it a lot. If you want to have good sexual health, you have to make sure that your cervix is taken care of as well. Reproductive health is so important to all of us, right? I always say this, everyone comes out of a female body. So we should all love women, right? Because we're either a woman or we came out of a female's body. And the cervix is a barrier that prevents infection from ascending to the uterus. So it's really important that that productive army is out there, or protective army is out there with the cervix. It produces the changes with your menstrual cycle. It facilitates and inhibits sperm passage. So all of this is so important. During ovulation, thinner mucus helps sperm reach the egg, enhancing fertility, which is another reason the cervix is so important. So what do we have to do, guys? We have to clean the cervix. We have to make sure it's clean. During childbirth, it's so important that your cervical health is healthy. You don't want to have bacteria and viruses, or you don't want to have issues in the cervix. You want to keep it clean. Cervical dysplasia is a condition that can happen, and it's abnormal changes to the surface of the cervix. It's often detected through a pap smear, but just because you have this doesn't mean you have cancer. It's just something that is often detected or can be detected. It usually is from an infection or HPV. So you guys hear a lot about HPV. A lot of people are exposed to that during birth or during different things that happen in their life, during sex. There's other ways that you can be exposed to that too, but it's something that definitely impacts the cervix. You have to basically cryotherapy, surgical procedures like LEAP and different other things can be used as a treatment for this disorder. HPV infections, again, we just talked about it. HPV is a sexually transmitted infection that is highly prevalent and can affect the cervix. And again, listen to that, highly prevalent. A lot of people don't understand this, but you could be walking around with HPV and have no idea that you have it. More people have it than you think. That doesn't mean everyone has it, so don't think that, but just know it's more prevalent than what people think. And regular screenings can detect it, and usually the doctor will try to do something about it. Cervical cancer is not something that any of us want to talk about, but it's something that can exist. And to diagnose that, you really have to do a pap smear or you do your DNA HPV testing. The treatments include removal of tissue, radiation, and chemotherapy. Many times you will catch it because there's pelvic pain or there's discomfort during intercourse or abnormal bleeding. So just know that that's how you can often first like realize something's wrong. And if that happens, you need to go to your doctor. The risk factors for cervical health are what we talked about, the HPV strains, high risk and low risk, the HPV and cervical cancer, HPV 6, HPV 11, and 16, HPV 18 are also associated with different things that could impact the cervical health. And so those are all things you can ask your doctor about and try to find out if there's any metrics to look at that. There are integrative and functional med ways to look at that, and every country approaches this differently. The United States has particular tests, but if you go to Nigeria, for example, there's different tests that they give for that. Lifestyles and environmental factors that can impact the cervix: smoking, sexual activity, immune suppression. So let's talk about that. Your immune system goes down by different things, whether you're shooting things in your body, taking illegal drugs. There's a number of things that impact your immune system. Being exposed to environmental factors, viruses, parasites, fungus, bacteria, all of those things can impact the immune system, which can harm the cervix. Sexual activity, remember, sexual health is important. One of the reasons I'm doing a sexual book is people need to understand the pros and the cons of different decisions they make sexually. It's not just about romance. It's not just about love. It's not just about fun. It's also about health. So people need to remember that. Smoking can impact the cervix. We've known that directly and indirectly for years. So if you are a smoker, just know that can have a negative effect on your cervix, and you have to do even more to clean out the inside and outside of your body. Genetics and other health conditions are HIV, which is a coexisting infection that goes along with HPV, which can cause sexual dysplasia and cancer due to immune suppression. Sometimes there's a family history of cervical cancer, which is responding to the immune system and cellular repair. Maybe there's something going on with your genes where it's not working effectively. That is a factor. And then, of course, going back again, I'm just going to reiterate this again, sexually transmitted diseases, you have to be very careful. There's all kinds of sexually transmitted diseases, and they can all impact the cervix as well as the rest of the body in a lot of different negative ways. So what's the prevention strategy? Pap smears are very important. They should never be ruled out. It's important to look at precancers and abnormal cells. If you don't believe in pap smears, then you are going to look at different other identifying factors, such as symptoms that you should recognize if you have cervical issues. So you need to pay attention to what I talked about earlier as far as symptoms, because so those could be a signal that something wrong is going on with your cervix. Because a lot of times it's a silent killer and you don't know. So you really have to pay attention to the things that were discussed earlier in this presentation to make sure you're taking care of your body. HPV test identifies strains of HPV, which can lead to cancer. Screening guidelines, pap smears every 3 years if you're 21 to 29. It's every 5 years if you're 30 to 65 years old. And remember, the HPV test and the pap smear, we should probably be doing both tests. Healthy lifestyle choices, remember the smoking, the safe sex. So getting rid of smoking, safe sex, nutrition, and exercise are all very, very important. And then when I say nutrition, it's eating habits as well as how you supplement your body with nutritional supplements. That's important. In my opinion, you want to do prevention. You want to take care of your body, get rid of the bad things in the body, support that beautiful city on the inside of your body and let it run, let it be happy, let it thrive. And you do that by giving your body the good things that it really needs. Early detection of cervical and treatment. If you have unusual bleeding or pelvic pain or abnormal discharge, you should always tell your doctor. You should do different tests like biopsies, imaging studies, if your doctor feels like you need and you agree. It's your body, so nothing should be put inside of your body unless you really believe it's something that's needed. Colposcopy, which is a magnified examination of the cervix, is often used as well. Kind of like a colonoscopy, but it is for the cervix and you're looking at that area. You do have different options. There's laser ablations, there's loop, there's LEAP, there's cryotherapy, there's all kinds of things that doctors can do with radiation and chemotherapy. And there's natural things you can do to support your body while you're going through that. Or if you choose to do things naturally, then you have to go to your functional integrative med doctor and ask them what are things they recommend. As far as our company, we really lean on the body is its own miracle. It is amazing. I'm not the healer. There's not a healer that's going to come in and just fix everything in your life, but you've got to support the overall body, and the cervix is part of it. So with Clean Slate, you really want to look at cleaning out the body and focus in your mind. And I always tell people, when you take a nutritional supplement or when you eat, like when I eat, I pray before every dinner, and I pray that the food is going to help my body, to the nourishment of my body. With supplements, you have to do the same thing. You're hoping that those vitamins and minerals, those tea leaves, those plants, those seeds, those oils go into the body to really support the overall body. You really want that. You want them to get rid of the negative things, support the good things in the body. The benefits of Restore are another thing that would really supplement the body, because you need the strength you need to help all the organs in all the different areas of your body, whether it's the sexual health organs or it's your brain or your heart or your lungs or anything, or the skin, right? Restore, I think, is something that I was so excited to work on because I wanted something that I could take with me no matter where I went, that had the black cumin seed, had the turmeric curcumin, that I was able to put the aloe vera, all the things in it to really support the overall body. Zero in is extremely important as well. Zero in, I think, for cognitive functioning is important, but one of the things I don't talk about enough is the key ingredients in zero in are also targeting the overall body to really supplement its performance, and not just sexually, not just cognitively, but from a performance perspective. We can't make claims that we're fixing everything or anything in the body, but supporting those overall organs to be as good as they can be is what the aim of zero in was. And I was really focused on sexual health and cognitive health. And then as the case study started unfolding, we saw the performance that people were doing, even from an athletic perspective, and that kind of changed how we were able to view things. Natural barrier support, again, your basic vitamins with your D3, your zinc, and your vitamin C are extremely important. Don't ever minimize natural barrier support. It's really needed for supporting the body. And I can't just say it's just natural barrier support, but I feel like it's one of the best different formulations with vitamin C, vitamin D, and vitamin and zinc that really assist with the body. Immune defense shield with your vitamin K, your vitamin D3, your vitamin C, your quercetin, and your NAD. I think people know this is one of my favorites. It's my go-to to really make sure that I am giving my body what it needs. I'm a huge fan of the mitochondria and the telomeres and anti-aging and reversal of aging. So this particular formula was imperative for me to make, to really focus on those different issues, but also in the overall health of the body. Going back to the cervix, it's an important part of the body. So making sure that you remember every single organ and part of this beautiful city that's inside is important. And that cervix is connected in different ways to different organs throughout your body and through the whole communication pathway of the body. ReLive Greens, we all know it's one of my favorites. Those greens are chock full all kinds of vitamins and minerals and nutrients to really support the body, not just in detoxification, but in supplementation. And it has a pre and probiotic to make sure it's really helping in those areas, because we know how essential that is to the overall body health. And then you, of course, have to add crush, because the peptides are extremely imperative as far as the building blocks of the body. We know as you age that you lose a lot of that. I always say it's like a Lego set. You've got to have the building blocks to the body in order for the body to work effectively, and you need the peptides. Of course, I like our three-step peptide system for the skin, but I also like it for the overall body, which is why I think it's important to take it orally as well. So I think that's the end of this. I hope everyone is having an amazing week and an amazing time. These root U's are to really educate people on certain topics, not for us to claim that our products are curing things, but to show how we can support our overall function by the food we eat, by the exercise we do, by the least amount of stress we can bring into our lives, and by supporting this community so we can all be in this together to have a better life. When we manufacture these products, our goals are to increase manufacturing so that we continue continue to be the best products out there that help the most people. However, we recognize that there are other products out there that are extremely helpful for people's bodies as well. And we try to encourage people to remember that this body is a miraculous machine that you also have to make changes to throughout your life. And you have to be smarter than a virus or a bacteria or a fungus or a parasite. And to do that, that means you have to focus on the overall health of the overall body, and not just one day, not just 2 days, but every day of your life, because there's only one you. Thank you, everyone. This is Dr. Christina Rahm.